As audiologists, we diagnose and treat disorders of hearing and balance. So both are doctors who specialize in ears, just different parts of the ear, different aspects. Audiologists deal with the function of hearing and the function of balance and all of the effects that come from hearing loss and disorders of the inner ear. ENTs, they more so specialize in the medical management of ear disorders, so that person would be someone who writes a prescription, performs a surgery. They deal with the medical aspect of that. Usually, before you see an ENT, you are required to have an audiogram performed anyway. So if you have an ear complaint, unless it's a sudden development, in which case you should seek medical attention immediately, you probably are safe to go with seeing an audiologist first. The audiologist, after they test you, will be able to tell you whether or not they think it's a good idea to move on to ENT, and they'll help assist with that referral. So if they think that there's an underlying medical cause, or if there's a red flag for something that we might need imaging for, we'll send you on to the ENT. But if we feel that it's something that can be managed in our care, then you'll stick with us and move forward there. We treat, in this office, hearing loss, and that can be at any age, at any severity. So we test hearing, and based on the results, we might recommend amplification, and that can come in the form of hearing aids, bone-anchored hearing aids, cochlear implants, and it might just be assistive listening devices. So if you're not quite ready to move forward with hearing aids or amplification in the traditional sense, there are lots of assistive technologies that we can help recommend. A hearing aid specialist is an individual who receives a shorter amount of training in the fitting and dispensing of hearing aids. From my understanding, it can be a course ranging anywhere from 3 months up to a year, and it's like a specialized license that they obtain. A doctor of audiology is someone who goes to school for 8 years and receives extensive training, not only in the fitting and dispensing of hearing aids, but the anatomy and physiology that underlies conditions for which we fit those devices. So there's quite a difference between the two. Both can be adept at fitting those devices, but especially when it comes to treating comorbid conditions that happen with hearing loss, such as tinnitus, hyperacusis, which is reduced tolerance for sound, misophonia, those are conditions where you really want to see someone with that extensive background.